Nurses and legislators from around the state aren't holding back their anger and frustration tonight against Mayo Clinic.
Yeah, this days after an alleged blackmail threat from the hospital surfaced, telling lawmakers to either change legislation or risk Mayo officials withholding billions of dollars in state funding.
ABC 6 News reporter Maisie Olson was at the state capitol today for the press briefing from the Minnesota Nurses Association. She has more from local nurses on that ultimatum.
These nurses and lawmakers say that shocked is an understatement. They say they've been negotiating with Mayo Clinic for months now and have created a lot of adjustments to that Keeping Nurses at the Bedside Act. So to see Mayo Clinic executives threaten to pull out is extremely disappointing. The controversy boils down to concerns with a new bill called Keeping Nurses at the Bedside Act. Nurses speaking out against Mayo Clinic today say it's not the first time hospital officials refuse to listen or work with nurses and employees.
It is completely unethical for Mayo, a non-profit corporation, to attempt to override democracy and disrupt the legislative process at the last minute with what are essentially blackmail tactics. Mayo and our elected leaders must answer to the public and not powerful corporate interests.
Mayo Clinic officials are firing back, releasing a statement that says, "We agree our nursing staff face many challenges. However, we believe this bill does little to address the real challenge, recruitment and retention of the healthcare workers and staff Minnesotans need." While the bill has bipartisan support, some lawmakers say if a hospital as credentialed as Mayo Clinic is raising red flags, there's something wrong.
I do think that those are the important parts, and I do not believe for 1 minute this is blackmail. This is not blackmail. It just means we're not going to invest $4 billion in growth in a state that's not going to allow us to continue to practice the gold standard of healthcare that we all have come to expect. And so you can't make people choose to invest in Minnesota.
For now, Mayo Clinic has indicated that they're still taking part in negotiations, but nurses with MNA say it seems like if Mayo officials don't get their way, they'll take business to a different state. Nurses from around southeastern Minnesota showed up in order to hold Mayo Clinic accountable for the alleged blackmail, including in Austin. Not present were any nurses from Rochester. In St. Paul, Maisie Olson, ABC 6 News.